Hi everybody. Today I'm here with Jayne Plante. She came here to Ottawa to meet with me, talk to me, to tell her story about her pain, her chronic pain of 37 years in chronic pain. And then for the last 1 year and a half,
just
basically.
over 1 year. Mm-hmm.
Yeah, anniversary,
Yes.
one anniversary that she is almost totally, she'll tell the story, pain-free. And when we talked the first time over the phone a couple of months ago, I couldn't believe, and I said, what? 37 years, and what did you do? What happened to you? And what kind of pain you had? And I think this story is worth telling because it may help some people. I understand that not everybody will have the same luck and the same outcome that she had, but I hope some people will. I hope some people who qualify for this type of pain, which is basically nociplastic pain that I talk a lot in this channel. So if you have nociplastic pain, your doctor told you that you have nociplastic pain and you don't know where to go, what to do, listen to this video because Jayne has a lot to teach you. Jayne, thank you so much for coming here and talking to us today.
And thank you for having me, Doctor. I've been waiting to meet you in person, and I'm excited to be here.
Yeah, I had to travel from Toronto to Ottawa
Yes.
for a conference. I'm here today for a pain conference, and Jayne came here to meet with me for this interview. So Jayne, first of all, tell us a little bit about how this pain started. Go back 38 years.
Yes.
How old were you? What were you doing? Where was the pain? And then tell us the beginning of this pain.
Okay, so yes, the beginning was when I was 20 years old, so many years ago, and we were in a car accident, rear-ended by a tow truck, and I had a bit of whiplash, and off I went to physiotherapy with some pain. And the pain never really went away from that moment on. It started in my low back, and I had the physiotherapy treatments, and off I went to post-secondary around that time to become a dental hygienist. And that's also a profession where you're leaning forward, holding static positions, bending your back. So a lot of dental hygienists have back pain. So it was always kind of my belief that the car accident and then combined with the profession I chose was the reason why I had the back pain. So
the pain was, here in the back or in the neck?
Well, I was going to say it started in the lower back, and over the years it started to move around. So from the lower back it progressed to my mid back and stayed there for many, many years. Then progressed to my upper back and my shoulders. Same thing, kind of stayed there for many, many years. Then moved into my neck. And while it was in my neck, though, it would still come and go in my back at different times. Then into the base of my skull. And that's kind of the areas where it was the most chronic. But as all this was going on, and now knowing what I know, looking back, I had many other symptoms that would have been considered nociplastic or coming from my brain that I didn't really know anything about at the time. I had knee pain, hip pain, IBS symptoms, fatigue, high functioning anxiety, depression. My fingers would turn purple and numb. And now that I know what I know, all those symptoms were all being caused by the same origin, exactly. So over the years, I had many different diagnoses given to me by various medical professions. The whiplash from the car crash, and then degenerative disc disease, which in my 20s I thought sounded, really scary. Now,
did they do MRI too?
Yes.
Yeah?
Yes, I had several MRIs over the years as well, CAT scans, x-rays. So then they also said I had herniated discs, nerve impingement at C6, C7. They gave that as the reason why I would get the numbness and tingling and the purple fingers, repetitive strain injury because of my job. So yes, the MRIs, the CAT scans, the x-rays, I saw, I think 2 or 3 different orthopedic surgeons, 2 different neurologists. Over the 37 years, I had 5 different family doctors. I also, of course, went to various physiotherapy, chiropractor, massage therapy, athletic therapists, acupuncture, Reiki, osteopath. I mean, you name it.
A lot of time and resources and money.
Yes, no, exactly. I mean, my calendar was filled with appointments. Filled with appointments. I was still working, but I had to reduce my work days, the number of hours in a day that I could work. I tried many different medications over the years as well. I was on anti-inflammatories, medication for nerve pain, medical marijuana I tried, opioids.
Wow. Surgery?
That was talked about. I was never real excited about the idea. I just have heard of a lot of people who had back surgery, neck surgery, and weren't any better or actually ended up worse. So I'm kind of thankful for that now, that I was never gung-ho about that idea, because now I know that it
would not have helped.
It would not have helped me one little bit.
Doing all of these appointments and seeing all these professionals, how did you feel? How were you feeling all these years and your pain not going away, you're still having pain? How did you feel?
It was very, very difficult. At times I was the pain warrior, just pushing through, which I know had a lot of effects on my mental health as well. But yeah, my life became so small. I couldn't sit for long periods of time. I couldn't stand still for long periods of time. Really lying flat out on the floor was where I found the most relief. So even when I was working in between patients or on my lunch hour, I was lying down flat out. I would walk in the door from work, head to the kitchen, lie out flat on the kitchen floor while my husband was cooking dinner. Any social event we were invited to, any social outing, for me all became wrapped around, how am I going to manage this? Is there going to be somewhere where I can, run off in a corner where I can lie down? How long am I going to have to be there? What's the furniture going to be like that I'm going to have to sit in? How long am I going to have to stand still? Am I going to have to, leave early, go home? How high is the pain going to get during this event?
Because it could the pain could become very intense during those events.
Oh yes, yes, extremely intense. And at times, I wouldn't even go sometimes. I had to balance out what the event was. Was it worth what sacrifice I would have to, kind of go through to endure the pain? I had also been withdrawing a lot socially from friends and family because I found it exhausting to be with other people and trying to be pretending that I was all right. So yeah, things were very low, but I was not wanting anybody to see that. I mean, my husband had a small, inkling peek into it, but really I was protecting everybody I was close to from how much misery I really was going through. So about 10 years ago, somebody suggested I try yoga. So off I went to yoga, and I found from the mind-body connection in yoga, I did find it helpful somewhat. And then I started my own pretty regular meditation practice, and I did a mindfulness program, the 8-week stress reduction mindfulness program. And I found, I was probably 5 to 10% better from doing that. So I knew there was a mind-body connection, and I knew when my stress was worse, my pain was worse, but I had no idea the true connection. It was just kind of something, a little idea that was floating around in there. And then 5 years ago, I had to leave the workforce completely.
Completely stopped working.
Stopped working.
Because of the pain?
Yes, because of the pain. I was not the dental hygienist that I wanted to be anymore, that I could be anymore, and the pain had just become overwhelming. I just couldn't manage it anymore.
Like, doing your work, feeling pain, you're not in a good mood, and your patients are feeling pain.
Yeah.
And they're complaining of a little bit of pain here, and you say, I have a worse pain than you have.
That was exactly what was running through my mind, doctor. It really was, and I didn't.
You cannot imagine.
I didn't like that I felt like that.
I see, because you're not empathic anymore.
That's
with
right.
Them, right?
That's right, and that wasn't the person that I used to be.
So next time you go to a dental hygienist and you complain of your pain, think that they might be going through a worse pain than you are.
Exactly. So when I left the workforce, I still had some hope that things would get better, because I was still under the impression that was, my job was contributing to why I was in pain. But nothing got better.
Wow. Even after you stopped working, staying at home, not doing that posture anymore, did not get better?
No. And if anything, I found things kind of started to spiral and get worse, because now I was at home alone with nothing else to do other than focus on the pain.
Ooh. Okay.
So, things actually, got, I think, significantly worse in the last couple of years.
More depressed?
More depressed, definitely. More moody, but still wanting to put on that face that I was fine to the outside world. So one of the last times I went to my physiotherapist, I just said to her, my fear of the pain is just starting to overwhelm me. I was afraid to do anything because I didn't know what was going to bring it on today. How elevated was it going to get? Was I going to get any relief by lying down? And we chatted a bit about the fear of the pain. And I left her office, and when I got home, I thought, maybe I just have to talk to a professional, a therapist, about my fear of the pain.
And let me ask you one thing. Before this, have you ever, because by the time that you were thinking about the fear of pain, because that's when your life started transforming,
Yes.
How many years you had been on pain when you start thinking about the fear of pain?
Well,
37.
I only started thinking about the fear 1 year ago.
1 year ago. So 37 years. During these 37 years, did you see any psychologists, counselor, people who are more in the mind area of pain?
I didn't.
Why?
Because it never crossed my mind, and none of the other doctors, professionals I saw ever mentioned it. Suggested. I mean, maybe I had spoken with my physiotherapist about the fact that when my stress was worse, the pain was worse, but that was as in-depth as that side of the conversation ever got.
What did you do when you realized that the fear of pain could be paralyzing you and could be something that could be treated? We talk a lot about in this channel, many of my videos I mention the fear of pain paralyzed the person. Then they stop doing exercises, they stop living. And many of my patients, they don't believe. They say, no, I'm not afraid of pain, doctor. It's just the pain is so intense. You don't understand. I'm not afraid. I'm a very strong person. I can tolerate pain. I am stoic, and I'm not weak. They don't like me to hear about the suggestion that the fear of pain may be paralyzing, that their mind can be influencing their life and making them to stop doing things. So I'd love to hear what went through your mind, and how did you find that the fear of pain was something that you could tackle, that you could treat, that you could modify?
Well, like some of your patients, I thought I was very stoic. Well, not thought, I was very stoic. I endured all those years of pain. I was very stoic. I thought I had a high pain tolerance. And really, it was only the last few months on my own that I started to realize how much influence the fear was having over me. It really never entered my mind for all those other decades. So when I came home from the physiotherapist and I literally sat down and on my phone, fear of chronic pain. That's what I typed in. And you know, a few things started popping up that I had never heard of. Neuroplasticity. I mean, maybe I had heard the word in passing, but I really didn't know what it had to do with pain. You know, nociplastic pain. Alan Gordon's book, when I had put in fear of chronic pain, called The Way Out. A number of different things, and I just kept clicking on different things and reading more and more. And all of a sudden, I found myself down this rabbit hole like you can get when you Google something, but all of this information that was coming at me, it all very quickly to me made sense. That it could be. It definitely could be. Because I had tried every single other intervention possible, and you know, maybe some things helped for an hour, a day, a week even, but there was nothing that had helped long term. So I ordered Alan Gordon's book, The Way Out, off of Amazon, and it was there in 2 days on my doorstep. Picked it up, started reading, and I was probably only a few chapters into it, and I mean, the title is The Way Out, and I knew.
I'll put a link. I recommend this book in my own book. I talk about this book, and I'll put a link for you if you want to order that book.
Yeah. I knew it was my way out. I was certain. I know other people might not be certain right away. I think they just have to be open to the idea that it could. I just knew, and I just kept reading the book, and honestly, just from reading the book, my fear just dropped.
Wow.
Because I understood the concept that it was the brain, amplifying and making all these sensations so prominent. And the fear, without the fear, then it just has to settle down. Not to nothing, but definitely settle down. So after I'd read the book, I thought, well, I'm going to go the next step. I'm going to get professional help. Again, I went back to the internet. I don't live that far from Ottawa, our nation's capital. I was hoping to find, something what I would consider local. But really the only thing at that time that popped up on my screen was Pain Psychotherapy Canada. And I want to go back and take the word only out of that sentence because they've saved my life. So I don't mean that's the only thing that popped up. Went to their website, and it's such a unique clinic. They specialize in nociplastic. They call it neuroplastic. The words are kind of interchangeable. And all their therapists have either had chronic pain themselves or an intimate relationship with it, having a spouse, a parent who suffered from chronic pain. And they use these mind-body modalities to help people like me. So you can book in a free 20-minute consultation, which I did, and they have a questionnaire on their website with some criteria. You can go on yourself and look, or do you have this? Does your pain move around? Does it get worse with stress? Et cetera, et cetera. You don't have to have all the criteria. You really only have to have one or two. I had lots. I mean, I had almost all of them. So that helps people be more certain, but so I had to wait a couple of weeks for my first appointment. They offer virtual appointments. And in that time, I took the internet and was doing my own research and education. on this type of pain, on the topic, on the modalities used. People don't have to do that. That's me and my hypervigilant personality. I liked to find out as much as I could ahead of time.
The search on the internet for the fear of pain, you found that this could be the source of your pain, that this could be driving all these years of pain, and you tried so many other interventions that would work if your pain was nociceptive or neuropathic. Now you know those names, you're familiar with those things, right? Because you studied, you learned. Right. That's why I think education, knowledge is the main intervention that people with chronic pain need to do. They need to learn about their disease. You need to know, is your pain nociceptive? Because if it is an inflammatory condition, it would respond to anti-inflammatories, to ice, to cold, to surgery, nerve blocks. Okay. If it's a neuropathic pain condition, that it could be. I have patients that they have a chronic pain from neuropathic pain, and they respond to the anti-epileptic, the anticonvulsants, antidepressant medications. We don't need to go to high doses, and the pain is controlled. But when your pain is not nociceptive, it's not neuropathic, it must be nociplastic. And that opened the door for you, like when you heard about that 37 years in pain. And it was the first time that you thought about the mind connection, how emotions are trapped in the body, and fear is one of them. And fear is not bad, because I think in that case that your pain was protecting you. Right. Your brain was doing this to protect you from damaging your body and creating that pain that was so intense, and that's why you had this fear. So tell us a lot about, so what did they do? And by the way, the Pain Psychotherapy Canada clinic, I have been interviewed by them. Yes. And I have one of my videos in my YouTube channel is a link to their video on their website. So when you contacted them and you finally got an appointment, a virtual appointment with them, how did it work? How long did it take? Was it like a psychotherapy every week, many times a week? Was it very intense? Because some of my patients are afraid of psychotherapy. And I understand, they say it's too expensive. They're going to talk to a psychologist that will reinforce that their pain is psychological. And they say, no, my pain is physical, my pain is in my body. So they don't want to open that possibility that saying my pain is psychological, my pain is in my mind, in my head. How did you feel about that? Like opening up with someone, because psychotherapy means that we're going to work with your mind. So tell me about your emotions, what you were feeling. Were you worried about how these sessions of therapy were going to go, and what kind of direction they would take, what they would find in your mind? Some secrets inside of your mind?
I understand that a lot of people would be worried and fearful about going on that journey. I didn't have a lot of that. I was more excited because I really believed that this was my answer. But I understand not everybody might be excited to start psychotherapy. I also have to say, I mean, I'm sure all the therapists are excellent. I mean, my therapist, I couldn't have handpicked him better out of, everything. They make everything as smooth as possible. So the very first appointment is an assessment, which, they have to do and ask you all these questions. And I said, I know you have to do this assessment. I understand that. But I said, I know that I have nociplastic pain. And
let's start with the therapy.
And I know I can get better. I felt that I was going to be successful in this therapy. So the first modality we started off with was pain reprocessing therapy. And that is to reduce your fear of the pain, to make us understand that we're not doing damage in our body if we do the thing. If I sit for a long period of time, I'm not damaging my body. If I stand still for a long period of time, if I do any of those things that brought on the pain, my body is not being damaged. So understanding that, for me, the pain, the fear really dropped. And they pair that with somatic tracking, and I know you have a video on somatic tracking as well, where it's a specific kind of meditation where you're paying attention to the pain, but in a curious, lighthearted manner, not with fear, because there's no reason to.
It's not broken.
It's not broken.
That part of the body is not damaged.
Yes. So, the eventual outcome of the somatic tracking is for the symptoms to start to decrease, but initially it's outcome independent. You're doing it to reduce your fear and to learn how to lean into pleasant sensations instead of being focused on the fear and having a negative thought about the pain. You're pairing it with something more enjoyable. The amount of sessions it takes, really varies from person to person.
For you, how many sessions, more or less?
Within a few sessions, I was feeling remarkably better, but I know that's not the case for everybody. And probably in total, I had maybe 10 sessions, because I had decided after we did those first few modalities, emotional awareness and expression therapy was also recommended for anyone who's had trauma in their past. For me, it was definitely in my childhood. My childhood was full of fear, so it makes sense to me then.
Primed your brain.
That's right.
Protective.
That's right. But they make it clear that that's not an avenue people have to go down if they don't want to. But from the research I had done, your long-term recovery is more likely if you have a history of trauma, if you deal with it. It's better. It's better. And really, cognitively, I had always known I probably should have had therapy for my past trauma. I just never did because I was the warrior and I was just pushing through everything. Again, there was no trauma going through the traumatic events. I mean, they help you process it somatically in your body. It's not talk therapy, which is, I think, what a lot of, well, still current, but maybe old school was more talk therapy. I mean, you're learning to live in your body. And like you talked about earlier, all the repressed emotions, I never knew how to feel an emotion in my life. I only ever thought an emotion. I never felt. I didn't know how to do that, and they teach you how to do that, and it's a life skill I think that should be taught in childhood, for goodness sakes.
Everyone should learn, because we can't separate the mind from the body.
Yes.
And every emotion has to have an expression of our body. That's why arts is so important.
Yes.
Because you let it go.
Yes.
And
Expression.
Yes, Jayne. So I'm so glad that you mentioned the psychotherapy and how talking and feeling those emotions helped you. So I think we would love to hear about what happened after you did this psychotherapy. What did you start doing differently that you were not doing before? Like for almost 37 years, you had to stop working, and then your life became very limited. You were not even getting out of your house too much. Is that true? And then how was what's the difference? What are you doing now that you could not do a year ago, for example?
Right. So early on in the therapy, a part of it is starting to engage in life, because everyone with chronic pain has made their world so small. And at that point, you're engaging in life with the symptoms, because the symptoms are still there. They're generally reduced, or your fear of them is reduced at least. So engage in life. I started doing things I hadn't done. I started biking very small. I mean, 3 blocks, you know. I said to my husband, we're going in the kayak again, but you know, we're going from here to that dock. Like, it's not very far. And each time you're teaching your brain, this is safe. I'm safe doing this. So gradually, I did those graded exposures with things sitting in the car. I mean, before I started the therapy, I couldn't get here to Ottawa to visit my adult son. My husband had to drive, and I had to lie in the back seat of the car. You know, today I can drive to Ottawa. I could drive to Thunder Bay right now if we had to.
Which is a long way from here.
Which is a long way from here, yes. So, I mean, my life has just totally been transformed. This week I biked 37 kilometers.
37 kilometers?
Yeah,
more than I do.
With a cycling group. I'm playing pickleball. I'm hiking. We went on a trip again last month. I mean, I'm traveling again. We went to the Grand Canyon, and that was a biggie for me to get there and stand on the edge of the Grand Canyon and say, like, look at me. I did it. Something I never dreamed that was possible. So what am I not doing? I mean, I'm never at home. I'm volunteering. You know, I'm part of a seniors group that we're so active doing hiking and coffee together, and you know, here and there and everywhere. My husband's retiring next month, and we're so excited because my life has changed so much that now we have all this to look forward to together. And I also want to say it's so much more than just getting rid of the pain, because your whole life transforms. I feel like I'm now the person I was always meant to be, but that person was hidden under all that pain and fear and never ever had a chance to live. There's joy in life and connection with people that I've never really felt before.
Wow, 37 years.
And you know, I want to say to people who are listening, what have you got to lose to try this therapy? It might not work as quickly. It doesn't work 100%. I still get the occasional symptom, usually if I do something new, something out of my comfort zone, because that still makes my brain feel a little bit fearful. But I'm pushing that. I'm not satisfied with just staying with, you know, what gives me no symptoms. No, I'm pushing that so my brain is going to get comfortable with new things and with the traveling. I had symptoms on my trip, but it didn't stop me from doing anything. In my regular everyday life, I'm pretty well symptom free. It's only when I'm doing something.
So the last year you're living what you didn't live in the last 37.
I'm making up for
You're
lost
making
time.
up for the lost
I
time.
really am. It's just so incredible. I mean, things that people take for granted, but to think that I can drive down here now and visit my son if I want. I mean, you know,
You could never imagine doing that.
No, I couldn't. I didn't know that these modalities existed. Like, nobody had ever mentioned them to me.
What would you say to the healthcare professionals, if there is any doctor, physiotherapist who is watching this video? What would you tell them to do differently with patients like you?
Yeah, if nothing's working, we need to look outside the box that the medical field likes everything to fall into. And I feel that, you know, the traditional medical field has failed my type of chronic pain. That can't be changed. My 37 years of suffering can't be changed, but I'm here to spread the word so that others don't have to suffer as long, because we need people to know about this. We need more healthcare professionals to know about this. I know you're spreading the word. You're on a mission, but boy, sometimes I feel I'm hitting a lot of dead ends. You know, in my own little community. I have two healthcare professionals, one a chiropractor and one a naturopath, who have heard my story and who are passing on this information. And my naturopath, we're going to do a community presentation in June. But I've had a lot of people who treated me for years and years and who don't want to hear about my recovery, and that's very disappointing.
It is. Yeah, because you want to give back and help those who don't need to suffer.
Yes.
And I can tell you, in our pain clinic and with my 30 years of experience seeing people with chronic pain, a lot of people have this kind of pain. It's true that it's not everybody who has chronic pain.
Oh, right. Yeah.
Not everybody who has chronic pain will have this same kind of nociplastic pain. There are people who have nociceptive, people who have neuropathic pain, mix. Sometimes it's a mix of all three. But when it is only nociplastic pain, because your injuries, whatever that whiplash was 37 years, has healed.
It's healed.
Those disc herniations that you had in your MRIs, they were not causing the pain. But a lot of people get, in that details, and they keep doing therapy, physiotherapy, or injections and blocks. That will not solve the problem. Thank you so much, Jayne, for telling your story. I hope people will watch this video, get inspired, and get that spark. Maybe I think if you tried a lot of things and they didn't work, think like Jayne. Think outside of the box. Let's try something different. Maybe there is a mind-body connection. Maybe it is nociplastic pain. We are here on a mission, you and I.
Yes. Oh, definitely.
to have this. The word spread out. Thank you so much for coming here today. Is there anything else you would like to say today that we didn't talk and you think it's important?
Well, just try, climb that mountain. I know it can feel intimidating, but you're not getting any better where you are. So, there's that little bit of hope and opportunity, and you just take it one step at a time. And once you start to see some improvement, a little bit of improvement opens the door for you to see that this is a new room that you have to explore, and a whole new room, and it can lead to a whole new life that you don't even know is possible.
I think some people, let me just touch on that. Some people are afraid. I had people that they are afraid of trying something new and get disappointed.
Right.
Because they tried their whole life, they tried a lot of new things.
Yes.
And they got disappointed with this and that. And they say, no, I don't want to try this one because it will be another failure that I will add to my list of things. We'll never know until you try it.
Yes, and I just think, but if you don't try it, where are you going to be?
Yeah, nothing will change.
Nothing will change, and there's. And
you don't have nothing to lose because it doesn't have any side effects.
No.
It's not like taking a pill that if you start ingesting that pill, you're putting chemicals in your body and side effects. This kind of therapy, there are no side effects. And another thing that it's important, I had people who tried PRT, and I'm pretty sure I have patients. I'm pretty sure they have nociplastic pain, and they did try PRT, and they came back to me and said, my pain didn't go away, so it didn't work for me. Because we're still in the beginning of trying this kind of mind-body connections and trying PRT, I tell them, but you are not doing pain reprocessing therapy because we want to get rid of the pain initially. We want to get rid of the fear of pain, which is the fuel of pain. Your pain, one day your pain will get better. Do you agree with me? That's how you felt?
That's 100%.
You told here that first you felt the fear was gone, but you still had pain.
That's right.
And I have a lot of people that they are giving up this kind of therapy at that point.
Right.
Because they are not seeing the pain going away.
But I mean, the pain doesn't go away right away. I mean, the PRT has to be outcome independent. You can't be doing it with the thought that the pain's going to be gone by the end of this session. It's outcome independent. The fear is going to lower, and then once your brain starts to feel safe, then the symptoms will start to reduce.
It's almost like a consequence.
Yes.
Because I think if they try to lower the pain, they create more stress.
And intensity.
Right? If they focus, my pain has to go down, they are putting more fear in their brain because their pain is not going down.
No, and it is a tricky balance, but I had read all about it. My therapist explained it. So I was able to be outcome independent. It didn't matter. I was starting to engage in life with or without the symptom. I wasn't afraid. I wasn't afraid.
That's the secret.
It is.
Yeah,
and I think that's why it worked so well for me.
And quick for you.
And quick, because once I understood it, I wasn't afraid.
Yeah, so thank you so much, Jayne, for coming to our channel today and talk to our public. I hope this will help many people. And you know the drill. If you like this video, please give a thumbs up here and subscribe to this channel and turn on the notifications so you'll be notified every time I post new videos here. Jayne also has been very kind, and we'll put her contact information. If you have questions for her, you can go in the description of this video here and find her contact there. She's also on Twitter, and I'll put her Twitter handle there if you want to find her. And remember, this video is not for medical advice. We're not here to tell you your diagnosis or your medical advice, but this is only for education, to create awareness about these conditions. If when you are watching this video, if there's any emergency, something that you don't feel right, talk to your doctor, your healthcare professional, and if there's an emergency, please go to the nearest emergency department or call an ambulance.